Health insurance can be confusing, especially in the United States. Just because you have health insurance does not mean that your health care is free. While the majority of services provided in Shaw are free, anytime you go off campus for an appointment, there will be fees that you will have to pay. At Grinnell College, all students are required to have a U.S.-based health insurance policy with in-network coverage in Grinnell. We will cover what in-network means later on in the video. Grinnell College's student health insurance does not mail out physical health insurance cards. However, you may request one be sent. All health insurance information, including your insurance card, can be accessed through United Healthcare Student Resources. Their URL is uhcsr.com/myaccount. You will need to create an account the first time you log in. You can also download their app. Prescriptions have their own pricing structure. Be sure to check your insurance company for details. With the student health insurance, prescriptions can range from $10 to $30. If your prescription is a generic drug, you will pay at most $10. Oftentimes, generic drugs are available for less. If that is the case, you will pay the lesser amount. Let's go over some basic terms that are important to know. Copay. A copay is the amount you pay a provider at the time of service. You may have to pay a copay for each visit to your doctor. For the student health insurance, you will need to pay $20 every time you go to the doctor, as long as the reason for the visit is covered by insurance. How do you know what is covered by insurance? For the student health insurance, there's a large document that lists every service that is covered at gallagherstudent.com/Grinnell, or you can visit the provider website mentioned earlier, or visit their app. If you're not on the student health insurance, your insurance company should have this information available on their website. Let's go over some examples for those that are on the student health insurance. If you are sick and go to the doctor, that will be covered. However, if you go to the doctor to talk about acne, that visit will not be paid for by insurance. Medical procedures that are required are covered, but elective or cosmetic procedures are not. If you injure a healthy eye, health insurance would pay for that. But a routine eye exam or eyeglasses are not covered by the student health insurance. It's the same for teeth. Vision and dental insurance is separate from student health insurance. Grinnell College does have affordable vision and dental plans available to students. These plans are not included with the cost of your student health insurance. There is a separate enrollment and fee. If you are interested, more information is available at grinnell.studentbenefitplans.com. Okay, back to the important terms. Deductible. The deductible is the amount you pay before your health insurance begins to pay. Some visits have this and some do not. For example, if you're on the student health insurance, the deductible doesn't apply for an in-network doctor's office visit. Instead, only the $20 copay applies. And that $20 you pay does not go towards the deductible. However, any labs or procedures done in the office would go towards that deductible. The deductible amount starts over each plan year. For the student insurance, that's August 14th. This means that you have to pay the deductible each year before insurance will begin paying. The student health insurance deductible for in-network providers is $250. For out-of-network providers, it is $500. The in-network and out-of-network deductibles are separate. This means if you go to an in-network provider on the student health insurance, you'll have to pay a $250 deductible. If you've met that deductible, but then go see an out-of-network provider, you would then have to meet the $500 deductible for that out-of-network provider. Let's talk about a deductible example. If you have a $1,000 procedure, you must pay the $250 deductible before insurance will begin to pay their portion of the remaining $750. That remaining portion falls under coinsurance, which we'll talk about next. But just know that you will have to pay the deductible before insurance will begin paying their end. Coinsurance. Coinsurance is a certain percent that must be paid after the deductible. This payment is for covered services only. You may still have to pay a copay. Now, I just used a lot of words, so let's go over the example. The student health insurance covers 80% of a bill. After the $250 deductible, you will have to pay 20%. The 20% is the coinsurance. So on our $1,000 procedure, you would pay the $250 deductible. That leaves $750. The coinsurance you're responsible for is 20% of $750, which is $150. So the insurance company will then pay the 80% or $600. This can be confusing, so remember you can always schedule a time with someone at Shaw to review this to help you understand. Remember in-network and out-of-network? They're back. In-network means that the insurance company has a deal with these providers. They'll pay more of those bills and you will pay less. Out-of-network provider means that the insurance company does not have a contract with these providers and the insurance company will pay less and sometimes none. You will end up paying more. Student insurance will pay 80% of the bill for in-network providers and you pay 20%. For out-of-network providers, student insurance covers 60% of the bill and you pay 40%. You can find in-network providers on your insurance company's website. Let's talk about emergency room or ER visits. Emergency rooms should be used for emergencies or when no other care is available. If you are able to use another option for care, your care will end up costing much less. Here's why. ERs have their own copay. Remember the doctor's office visit copay that was $20? Well, for those on the student health insurance, the ER copay is $150 for each visit. This is in addition to the 20% coinsurance for any imaging or lab work that might be done while you're in the ER. Have you been to the doctor or another healthcare provider recently? Please check your school mailbox for bills. It can take a while, we're talking months, for bills to be sent, as the doctor has to send the information to the insurance company. The insurance company then has to process it. Then they have to send it back to the doctor's office, who has to process it on their end, and then the doctor's office sends you their bill. Oftentimes, the insurance company asks students for more information. If this isn't provided, the whole claim can be denied. So you want to make sure you keep an eye on your mailbox for these requests. They do look like junk mail. Unpaid bills are sent to collection agencies, and this does affect your credit score. So again, please make sure to check your school mailbox. This was a lot. If you have any questions about billing or insurance, you can always come to Shaw for help. We know that health insurance can get pretty complicated. For more information, you can visit our website or visit our Instagram or Facebook pages.